Hello. Welcome to our YouTube channel. In this video, we'd like to tell you a little bit about your upcoming MRI examination. MRI is also called magnetic resonance imaging or nuclear magnetic resonance, and is particularly suitable for providing images of the internal organs. Unlike other imaging methods, such as computed tomography or X-ray, MRI does not expose you to harmful radiation. The MRI scanner works with a strong magnetic field, so you will be asked to remove all objects in the changing room. These include eyeglasses and jewelry. But remember, there might also be metal objects in the clothes you are wearing, like zippers or bra wires. Some metal objects may be located inside your body and therefore cannot be removed. These include implants, pacemakers, and prostheses, which, depending on the material they are made of, may be affected by the magnetic field. As soon as you've gotten changed, you will be brought into the preparation room. For some examinations, contrast medium has to be administered in order to distinguish some structures more clearly. If this has been planned for you, you will get an IV or be fitted with a port. Depending on the body region to be examined, you will be positioned either head first or feet first on the patient table. Usually, you will lie on your back. The medical staff will make you as comfortable as possible. Do not hesitate to ask for more cushions or blankets if the position you are lying in is uncomfortable. When the contrast medium enters your body, the area might feel a little cold or warm. You may also feel an increased urge to urinate. Some patients have also reported a metallic taste in their mouth. All these sensations are completely normal and will subside after a short while. Before the staff leaves the room, a ball will be placed in your hand. You can squeeze the ball to make contact with the medical staff via an intercom at any time you feel that you have to interrupt the examination. You will receive special headphones or earplugs to protect your hearing during the loud phases. The medical staff will select a coil relevant to your examination and place it on the part of the body to be examined. As soon as you have been prepared for the examination, you will be moved into the MRI scanner and the examination can begin. The staff will leave the room while the examination is being performed, but will constantly monitor you from the control room where they conduct the examination and check whether your images are clear. The staff can also make contact with you via the intercom, for example, to give instructions. For some parts of the examination you will have to hold your breath for a few seconds or breathe very shallowly. If this is required for your examination, you will be informed in good time. It is very important that you remain still throughout the examination. As soon as you move, the images will blur just like when you take pictures with the camera. Blurred images cannot be interpreted and the examination will have to be repeated. The MRI scanner makes a noise, which you can hear in the examination room, even when it is not actively scanning. Depending on the type of MRI scan, the sound, rhythm, and frequency will change over the course of the different phases of the examination. The examination is now complete and you can get dressed again. Afterward, the radiologist will evaluate your MR images and pass on the report. Now you know what to expect when you undergo an MRI examination and hopefully feel well prepared. Please do not hesitate to talk to the medical staff if you have any further questions. Good luck with your exam.